Hi guys, in this case we have a case of sigmoid diverticulitis. I would take this case as if something I'm seeing in the ED. Let's say the history is that patient comes into the ED with left lower quadrant abdominal pain. So then, like I told before, the way I start is that I first start at a lung window, look at the lung basis quickly, make sure there's no big pneumonia, pleural effusion, or pneumothorax, and then go to soft tissue window down. And the first pass, I'm just taking 15-20 seconds, just getting a quick view of every organ once. So liver looks okay. I look at the spleen. I look at the gallbladder. Looks okay. Look at the kidney. There's no big stone or hydronephrosis. I still look at the pancreas. Again, one of the things we talk about in abdomen pelvis CT is inflammatory fatty stranding, which is anytime there's an inflammation in the organ, the fat around it tends to be more dense because of water in it. The fat around the pancreas looks pretty good. So pancreas looks good. I look at the kidney and then I quickly go down. I look in the region of the right lower quadrant at the area of the appendix. And I don't know if this person have had appendectomy or not, but at least I didn't see the fluid or anything. And then right now, the thing that catches my eye is this loop of bowel. So if I follow it down, this is our, anus, rectum. So these are sigmoid colon. And to convince you guys that the wall is thickened, so this wall goes from somewhere around here to here. Let's look at our ascending colon around here. I mean, this is pretty decompressed up here, so the wall may look thick, but right around here, this is how thick a ball wall should usually be around. And see how thick it is right here. On top of that, if you compare the fat, especially right around this diverticulus, see how white this looks as opposed to, let's say, fat here or even in the subcutaneous tissue. It looks really um, dense, and that's due to presence of fluid and edema. So the sigmoid wall is thickened. There's a ton of diverticula here. One, two, three, four. There's a lot of diverticula. The wall is thickened with surrounding fatty stranding. So this is a case of sigmoid diverticulitis. If I go up, here there's a lot of diverticula too, but at least the wall doesn't seem thickened. This person has a lot of diverticula. So this is a case of sigmoid diverticulitis. I know it now. Now let's look for complications. So the complication I'm looking for is that do I see a do I see an abscess, a big fluid collection? Not really. This is just one prominent diverticula, but do I see abscess? No, I don't. The other thing is, do I see perforation? To check for that, I look for free air. So let's carefully look. So these are just air in the diverticula itself. Do I see air just freely outside? Not really. So let's just go down and sometimes if you look at the interior part, the air is light and would come up. Do I see any air anywhere? No, I don't. The next thing I'll look at is that I would want to see that there's no thrombosis of the mesenteric vessel. So let's look at that. So there's our portal vein, left and right branch. There's our splenic vein. There's our superior mesenteric vein. Let's try to follow the superior mesenteric vein. Nothing. And we'll try to find my. So from the splenic vein comes out my inferior mesenteric vein. And again, if I follow it down around here, it looks pretty patent. Now, at this point, I would follow my source pattern. So, go down to the liver, follow the hepatic veins are not well opacified with contrast in this case, but go down to my liver, look at the portal veins more carefully, look at my spleen, pancreas more carefully, adrenals. This adrenal has it's a slightly nodular contour, but that's normal. Follow my kidney, and this person has kidney stones right here. There's a cyst right here as well. Now let me follow this ureter down more carefully to see if I see any stone in the ureter. So there's my ureter right here, right there. I'm following it down. I think it's right here. It goes over the iliac vessels. And so far the ureter, it's not even dilated, so the probability of having a stone is pretty low, but I was able to follow it to the uterovesical junction here. The other ureter, let's follow it back again. It's not dilated, so I think the probability of this ureter having a stone is really low, but we'll follow it up and there's nothing. And we can check for lymphadenopathy as well. There's a bunch of prominent lymph nodes. There's one right here. There's a few right here. It's just scattered, prominent, nothing that I would call, like way abnormal. There's a couple of lymph nodes here too. There's a few prominent one, but again, even this seems pretty big, probably more than 1 centimeter in short axis. So let me try to measure it. How do I do that? Short images, get link, toggle. Okay, I don't know how to measure it, but even something like this, I usually let it go. And follows, there's more prominent lymph nodes around here. This person has arteriosclerotic disease in the abdominal aorta, but I didn't see any aneurysm. And to look for aneurysm, again, it's really easy on the coronal because see how much of the aorta you see. So I'll follow my source pattern at this point. Thanks for watching my video.